Also your highlights. I don't know if you guys heard much of the highlights stuff. And you also
Welcome, everyone. We're getting everybody logged on. Christian, can you help make sure everybody's muted when they come in, please? We'll give everybody a couple minutes to get logged on. Good. This looks fantastic. It's 7:05. I think I'm going to get started if that's all right with everyone. Hello and welcome to our Mayo Clinic Ophthalmology virtual open house. I am delighted to have all of you here. My name is Andrea Tooley. I am the residency program director, and it's just so wonderful to welcome you to Mayo. I have a whole slew of residents and faculty here with me tonight, and we're going to share everything about our program. Please ask questions in the chat throughout. We have residents and we'll all be responding. And then we're aiming for about 10 to 15 minutes at the end for an open Q&A. So any questions you have, please feel free to ask us and then put them in the chat throughout so that we can answer your questions as we go. And then we'll answer some more at the end. We can go to the next slide, Christian. So like I said, I'm the residency program director. I trained as a resident here at Mayo Clinic from 2014 to 2018. And then I went and did my oculoplastics fellowship in New York City. And then I came back and joined faculty at Mayo in 2020. When I came back and joined, I was the associate program director. And so I got to work directly with our past residency program director, Dr. Barkmeyer, who is here tonight, who's now our associate program director. We did a little switch. And he has been a wonderful mentor to me in terms of education and mentorship. And our past program director, Dr. Cheryl Khanna, who was the program director when I was in your shoes interviewing for this program, is also here tonight. So we have a deep, deep tradition of education and mentorship here at Mayo, and I hope you feel that tonight. And it's my first year as program director, and I'm just delighted to tell you all about our program. Next slide, please. Christian, can we go next slide? Maybe, maybe not. I don't think I have control of this. There we go. Okay, so I'll do a little intro about Mayo Clinic. We're in Rochester, Minnesota, which is this white star in the middle of the map. And we also have a health system that represents our hospitals in Jacksonville, Florida, Scottsdale, Arizona, and then all these other little stars and dots that you see across Minnesota, Wisconsin, and Iowa, spreading north, south, east, and west from Rochester, represent what we call this Mayo health system. This is a huge, huge health system. And what this means to our trainees, and what this means if you're a resident here within this system, is that we have an extremely stable practice pattern. We have referrals that are well set up, and we have a very deep, rich network of our local patient population. So you might think Mayo Clinic, you're going to see the most unusual pathology from every area of the globe. And yes, that's true. We have patients who come from all over the world to Mayo Clinic to see us here. And you will see some of the most rare cases that you'll ever see in a lifetime here at Mayo. But we also have a really deep local network of rural, underserved patient populations and patients from this whole area in the Midwest. We have 4,600 staff physicians and 4,200 residents, fellows, and students. So our graduate education program is gigantic. Incredible residents, incredible trainees. And that all kind of trickles down and funnels into the experience that you have as a trainee here at Mayo. Next slide, please. Our residency program is really a jewel of our department. Our residents are kind of the heartbeat, and they run the department. We have a deep culture and values for teamwork, innovation, respect, compassion. You're going to hear tonight about how much we value our clinical and surgical training. The clinical training here is absolutely top notch. You have a ton of autonomy and a continuity of care experience that is unlike any other, and you'll hear about that from our residents. We have a graduated autonomy philosophy. So starting right as a PGY1, you'll already have responsibility and autonomy, but it builds year by year. You have tons of faculty support. These are world-renowned faculty across subspecialties that will support you, but we give a ton of responsibility to our residents and we really push them and we expect excellence from our residents. And that really translates into outstanding comprehensive ophthalmologists. And that's our goal. That's who we want to train. Aside from our huge focus and dedication to clinical and surgical training, you have all the resources of a place like Mayo Clinic, our surgical simulation and all the different wet labs and resources we have. You'll hear about our research support, statisticians, there's public speaking training, there's all kinds of really cool things that you can get out of Mayo. We have an extremely generous trip travel policy. You're going to hear all about kind of those extras that just really give this well-rounded program all of the kind of bells and whistles that you could ever want for in a training program. Next slide. So with that, I'd like to introduce our fearless leader, Dr. Sophie Bakri, who's the chair of our department and a vitreoretinal surgeon and has really led us in incredible directions. And she'll talk to you a little bit about what we have here in our department. Dr. Bakri.
Well, thank you, Andrea. Firstly, I'm really glad that you pulled that picture of me looking really young. So appreciate that. Thank you. So I just want to thank everybody for being here. I'm in total support of the residency program. It is an amazing residency program. I really think that the program is quite unparalleled. You will get a wealth of experience on local patients, national patients, international patients, a lot of diversity of patients, which I think is really important. You'll have time to see your patients. And really, we model the Mayo Clinic values, and that's teaching you in a very respectful manner and everybody learning in a respectful and collegial manner. And I think that that is a really important aspect of our program. Research is unparalleled. Every day that I'm here, it feels like a playground where I learn that there are more more toys to play with, more people to interact with, etc. And it's amazing, to be in a place. I've been here now, it's my 18th year, and I'm not bored of it. There's so much to do, so much to learn. It's just that how do you find the time to do all these things? So I think that as a resident, if you really want to take advantage, you have a lot of mentors. And as Dr. Tooley mentioned, a really deep commitment to education. I mean, the fact that our 3 most recent program directors, actually 4, Dr. Khan used to be a program director, are here, I think really speaks volumes to the fact that it's not just one program director and they're out the door. No, people stay in the department, people move on to other roles, but they understand education and they support it. So really, that's what I'd like to share. I want to make it clear that I'm available for questions, at any time. I'll be at the interviews and certainly, happy to chat with anyone who wants to learn more about the program. But I'm extremely proud of the program. More importantly, very thankful to our program leaders, our entire faculty who are committed, and also our residents and our fellows for continuing the great legacy of education at Mayo Clinic. So thank you, everyone.
Thank you so much, Dr. Bakri. I'm going to turn it over to Dr. Barkmeyer to introduce the surgical experience and procedural training for our residency.
Yeah, so we want to talk a bit about our early surgical and procedural training, which is just really part of the core philosophy of our educational program. This is really important, not only to get you involved early on and to build your skills, but it's also to set you up for success as you have your clinical and OR experiences, that you take fantastic care of patients, and that as you thrive and as you have more experience, then you're a more keen observer for the OR experiences that you have on your subspecialty services and when you start having your own patients referred to you. So the early surgical curriculum really boils down to having a series of group labs where we about every 3 months or so, we have a series of group labs in this brand new OR surgical facility. You can see here down on the bottom right-hand side. These microscopes all have video capabilities, and we can work together, and it's a lot of fun. We have fellows and faculty come in, and from PGY1 to PGY4, classes come in and all work together, and we suture with pig eyes. We have some human cadaver eyes. There's also a number of self-practice opportunities with the IC surgical simulator that we have. We were an early adopter of that. We're in the process of getting the newest updated model. We have, in addition to this wet lab here, that's located at the St. Mary's Hospital, where you're seeing patients after hours and on call, and you can pop down and practice. We have a vending machine where you can check out surgical instruments and just use these facilities. We also have a Guggenheim lab where we have a Zeiss microscope and an up-to-date Centurion system that we have one-on-one labs with as well. So in addition to those group and self-practice options, we also have one-on-one labs that we designed throughout the early stages of the curriculum. We set up your PGY 1 year where you start out in the oculoplastics OR within the first couple months that you arrive here, and you can get a lot of early hand-on surgical experience. Then you get adopted to anterior segment surgery and cornea surgery in the middle of the PGY 1 year. During that rotation, you have a one-on-one surgical cornea lab with Dr. Barrett. In the PGY 2 year, you start having one-on-one cataract surgical labs with Dr. Khan, and we have human cadaver eyes that you can do phaco procedures and early stages of the cataract surgical procedure there. We have two-on-one cornea labs during that year. We also, in the PGY 3 year with glaucoma, we have one-on-one labs as well. So this whole curriculum sets you up for success. We can go to the next slide. One of the other things we want to talk about is Dr. Tooley set up our Ophthalmology Olympics program 6-7 years ago. And this is right when you come in the door and are ready to start taking call as a PGY 2. We have this program where we all get together on the weekend and we have a series of lectures on urgent procedures that you need to know how to do while you're on call. So lateral tarsorrhaphy, temporary tarsorrhaphy, lateral canthelysis for patients with retrobulbar hemorrhage. We do lid lacerations, anterior chamber taps. We do intravitreal tap and inject. And then we divide up into teams and we practice and we compete with each other, and it's a lot of fun. This sets people up to have confidence when they go into their on-call later in the year that they can succeed and they've seen these procedures. We can go to the next slide. And I want to introduce Dr. Amir Khan and Dr. Cheryl Khanna to talk a little bit more about our surgical education.
That's great. Thanks, Andy. One of the things we're going to talk about is, in addition to the simulation, and Andy mentioned the opportunities we have in the practice labs, and we have human cadaver eyes, as he mentioned. We also have synthetic BioNikos eyes there as well. And then we also have the IC that he mentioned. And I would say all of these modalities are complementary. Each one provides a different aspect of the, let's say, cataract surgery that's a little bit more higher fidelity to the real operation. So I think that they're all complementary. And we'll just go on to the next slide. So one of the things that we've done, I'll speak for cataract surgery and Cheryl can speak for glaucoma and other things, is we've divided the procedure up into different steps. And we've kind of gone to the different rotations, and in this case, the anterior segment rotations, and divided the cataract surgery procedure into different steps that different rotations will train on. By the time you get to the rotation on what's called the quote-unquote COS surgical service with myself and two of my colleagues, we look to put all those steps together, plus any steps that you may have not gotten, into getting you complete cases. So as a PGY3 resident, we're hoping to get you, this is 15 to 25, I'll say 10 to 20, but somewhere in that range, complete cases from start to finish, and that you're the primary surgeon. And what this really does is it makes you much more comfortable that when you start as a PGY4 resident, as a chief resident, whether you're here or whether you're at the VA in Minneapolis, you can really hit the ground running and really maximize your surgical experience. And you can see the numbers there for our graduates for cataract surgery. Last year, probably about 225 cases, but really it can vary, and you can really maximize that number depending on your interest. Cheryl, I'll turn that over to you.
Great, thank you, Amir. So when you look at different programs, I want you to think, how is Mayo Clinic different from all of the others? And I think there's a few factors that really I can highlight for you. First of all, you start to do surgical procedures and steps of cases from day one. And I think that's unique. There are many programs where you won't operate until you go to the VA. Sometimes residents will only have patients of their own at the VA or in their chief resident year. But at Mayo Clinic, our patients are your patients. So at the very beginning, we share our surgical cases, you learn steps of procedures as a first year, second year resident. And I think that's really important. So we have a great balance between independence and autonomy and supervision. I think that you have supervision early on, and that's very important. And then you gradually get more autonomy surgically as your residency progresses. I also think that the wet labs really set us apart because you have a lot of hands-on experience from day one as you rotate through different subspecialties. So I think that that's how we're different from other programs, and I really encourage you to keep that in mind. In terms of glaucoma surgery, we do have a clinical glaucoma fellow, but it's important to say that we have 3 glaucoma faculties. So the residents and the fellows each have their own space, and they learn surgery separately, one-on-one with each glaucoma faculty. And I think that's a huge advantage.
Yeah, and I just want to amplify one thing. We mentioned graduated autonomy, but it's all, as Cheryl mentioned, it's all supervised autonomy too. So you will never feel left out, like you're out there by yourself without any resources to help you. Everything, there's always a staff available to help you.
We can go to the next slide. I'd like to introduce Matt Starr. Matt's a vitreoretinal surgeon, also trained as a resident here at Mayo, and then left and did his retina fellowship at Wills and came back to Mayo. And Matt and I trained together, and so he'll comment a little bit more on our surgical training. We're obviously very proud of our surgical experience.
Yeah, no, just to add a little bit more about, what the surgical experience entails. A lot of, residents are interested, or medical students are interested in the volume of the cataract surgery. And that's obviously a big piece of what you're going to be doing outside of, residency. But, here at Mayo, you're going to get a wide variety of, surgical surgeries. You're going to get, as Dr. Khanna said, big glaucoma experience with tubes. You do a ton of trabs. Just 4 or 5 years ago when I was doing them, upwards of 20 to 30 trabs in addition to all the tubes you're going to get to do as a resident, as a PGY3 resident. And then you go shift focus to other specialties. I don't even know how many strabismus surgeries I did. I stopped counting. It was so many. So you're doing a lot of eye muscle surgeries with the strabismus doctors. Then you go to other things. You're doing TABs with Dr. Chin, temporal artery biopsies in the minor room. With plastics, you're doing, all sorts of different things depending on kind of what you want to do. If you really want to push, doing blephs, torsorrhaphy, brow lifts, endoscopic procedures, you're going to do it all, early on in your training. And then as you advance and move forward, you're going to get, more and more skilled, and you're really comfortable doing a ton of suturing. In the retina clinic, if you're really interested, we're always happy to help kind of push residents in that direction. Just a few days ago, a resident who's not going in retina wanted to do a vit, and they did 2 vitrectomies with that day. Took a lens out, and the chief residents, I'll let them do my cataracts for me. Is I really try to push that wide variety of different kind of surgical experiences, types of surgeries. In retina, obviously you're doing a ton of stuff, and for me, when I left fellowship, I felt like I could do essentially almost any surgical procedure. Even though I went into retina, you just get a wide variety and a really good breadth of surgery. It's not just cataracts. You're going to be a great cataract surgeon, but you're going to do a ton of different things. Additionally, a little bit more about our VA experience. It is actually a really nice experience, as you do as a PGY4, where you spend 3 months in the Minneapolis VA with the University of Minnesota residents. You do a ton of cases. I think I did more than like 75 cataracts, and I was a chief resident on that 3-month block. But additionally, I got to spend time in the retina OR. I did blephs with the plastic surgeons. I mean, it's actually. I mean, it may seem like I have to go away for 3 months, but it's not really like that at all. It's actually a great time. I think everyone thinks it's a perhaps a negative, but it's really a huge strength of this program to actually spend 3 months away from everything and just really got to focus on cataracts at the VA. And then next slide, I think, is not for me. But yeah, just want to emphasize, huge breadth of surgery, and it's really not just cataracts. You get a ton of different things handed your way.
Thank you, Matt. Again, if you guys have any questions about the surgical experience, leave them in the chat. I'm going to transition to our clinical experience. And really kind of the crown jewel of our program is our resident run clinic. We call this clinic COS, Comprehensive Ophthalmology Service. And what it is an acute care clinic where any patient with an urgent issue, it's basically an IER, but it's just during clinic hours, that calls in is seen by our residents. I'm going to have 2 of our residents explain how the clinic works and why it's such a valuable asset to our program. But really, this is where you get the autonomy, you get to manage highly complex patients, and we really push you and challenge you. We have complete faculty support, but your ownership of the patients is on the residents. And so this is where we push you and challenge you. This is where the growth and the autonomy comes from. It's really all in COS. And the beauty of the way that our program is set up is that any patient you see as a PGY2 in COS becomes your patient for the duration of your residency. And so you have true continuity throughout the next 3 years of your residency. So if you see someone as a PGY2 and they end up needing cataract surgery, you're the one to do that cataract surgery when you're a PGY4. Or if they have another issue that develops, you're seeing them time and time again. And that really gives you a deep understanding of pathology. It's truly a great way to learn. So I'm going to introduce Dr. Tyler Kaplan and Dr. Haley D'Souza, PGY4 and PGY3, to kind of go over our resident clinic.
Awesome. Thanks, Dr. Tooley. So my name is Tyler Kaplan. I'm one of the PGY4s here at Mayo. And one of the reasons I came here was for the awesome resident run clinic that we have. I think it's really a phenomenal and unique aspect of our program. And our COS clinic, as Dr. Tooley says, is first, we're acute and urgent patients that are not established with any other ophthalmologist at Mayo they come to. And these patients, they identify as your patients, and they expect to see you, to the point where, as in one of these pictures, your name is on the door. And so, they walk into the room and it says, Dr. So-and-so. And so they think they see you as your doctor. It's not like, oh, you're a resident and then, where's the consultant? They expect to see you. Of course, you do have consultant supervision who are always there to staff the patients that are very challenging and complex pathology that comes in. And the pathology really varies. And that's one of the really great things about Mayo, as Dr. Tooley alluded to earlier. We have a lot of diverse pathology. And part of it's because Rochester is a pretty big city in its own right, and that we draw from a pretty large area that come to Mayo. And that's really beneficial to our training. We get a large amount of just the classic bread and butter pathology. And then also because Mayo is a tertiary care center, both medically and from an eye perspective, we get the chance to see really rare conditions, both eye and very complex systemic processes that have ocular involvement. And you really wouldn't see that unless you're at such an outstanding medical facility. In addition, the patients that you see, they become your patients for the entirety of your residency. And so that's really important because it's different than just seeing a patient at one moment in time, and you really don't know kind of the consequences of the decisions you made if someone's just seeing it later. And this is super important to our development because you're really managing the disease process longitudinally, and you figure out how to make decisions. You also learn how to take care of patients because you're seeing those same people for 3 years, and you learn how to have challenging conversations and how to make shared decisions with them regarding their care. And so at the end of your 3 years of your residency, you both know how to handle a tremendous amount of pathology, but more importantly, you learn how to take care of patients. We can go to the next slide for Dr. D'Souza.
Hi, everybody. I'm Haley. I'm one of the PGY3 residents here, and I'm just going to talk a little bit more about the COS clinic. So one of the really nice things is the way that our clinic is physically laid out is that all of our subspecialty staff are located centrally in one clinic and on one floor. And so the COS hallway is right next to cornea, retina, neuro-ophthalmology, oculoplastics, any subspecialty you might need to staff with. So if you're seeing a patient that's really complex in your clinic in COS, you can just step down the hall and find an expert in that problem just feet away from you. Which is a really nice thing to have because as Dr. Kaplan was saying, our pathology is really varied, and we do get a lot of these complex patients who are referred to us. Another nice thing is that we also have representation from every subspecialty in our clinic, including uveitis and ocular oncology, ocular pathology, which is hard to find. And we really have great faculty in all of those areas. And the fellows, our retina fellows, oculoplastics, neuro-ophthalmology, glaucoma, they all work really closely with us as well. And oftentimes we'll staff things in conjunction with them, with our subspecialty staff. So we have really great support in our clinic. Another nice thing is that the COS clinic is fully stocked. So with all the equipment you might need, you don't have to buy your own lenses. You don't have to have your own lenses. Every single room has every type of lens you might need for slit lamp exam, indirect exam, gonioscopy, any type of specialty lens you might need, we have right there. The minor procedure room is located in our oculoplastics hallway, and that room is fully stocked with a bunch of additional equipment you might need for doing a variety of minor procedures in the clinic. And you can actually do procedures on your own patients in the minor room. So, for example, if you have a patient who comes in and you have a concern for giant cell arteritis, you can do a temporal artery biopsy yourself in the minor room with support from the support staff and staffing from a consultant and or fellow if you need support. You can do other minor procedures like biopsies of eyelid lesions. You can do tap and inject procedures with patients with endophthalmitis. You can really do a variety of procedures yourself as the primary physician for the patients. So that's a really great resource that we have and enables us to really, again, be the primary caretaker for the patient and kind of see them all the way through from initial presentation to intervention to follow-up, which is a really important thing to be able to see in training. And I think if we go to the next slide, Dr. Kaplan will finish out our section on the resident clinic. I think you're muted,
Tyler,
Dr. Kaplan.
Sorry about that. So as Dr. Tooley said, our resident, we've graduated autonomy in our resident clinics. And so when you first start, you've just finished your internship and obviously you've done some ophthalmology, but you've done a lot of time in medicine. So it's very normal to not always exactly know what's going on right when you start. And that's totally expected. And so you see every patient often with a staff consultant or one of the chief residents. And it's really awesome because when you're with our staff consultants, you're learning from world's experts about how to examine various parts of the eye. And you learn these little nuances that you often will not read in a book. For example, when, someone comes in with a retinal tear, like, Dr. Starr teaches me these nuances of how to look at a retina or how to examine a tear appropriately. And then within our clinic, we generate a ton of procedures that we start really early on. And this could include, YAG capsulotomies for patients after cataract surgery. And then we do a ton of retinal laser for tears or retinal holes that come in, and also PRP for patients that require that, whether they're diabetic or not. And then later on, it can also become a source for cataracts. And this starts really, really quite early on. I vividly remember my first day as a PGY2, And my chief resident came and got me, and we did a YAG capsulotomy together. And, you know, it was just a phenomenal experience. And that just continues to amplify as you go on. And, you know, even by the end of your PGY2 year, you feel really comfortable doing a lot of these procedures basically on your own. And by the end of your residency, you can do quite a ton of procedures, whether it be laser procedures, minor procedures, and then obviously surgery. I think we can go to the next slide.
Thank you so much, Tyler. We can answer more questions about the resident clinic and our clinical model in the chat, and we'll do some more Q&A after. I'm going to bring back Dr. Cheryl Khanna, our glaucoma specialist, to talk about volunteering and life in Rochester.
Thank you, Andrea. So we've established that the training at Mayo Clinic is phenomenal. And now I'd like to touch on, you know, what is it like to live in Rochester, Minnesota? I've been here for 30 years, and I can personally tell you that this is a great place to live and work. I think it really provides an opportunity for work-life balance, whether you're a resident or a fellow or on faculty. You know, I can tell you that compared to my contemporaries, our volumes are very, very reasonable that we see at the clinic. I can't guarantee that you'll always go home at 5 o'clock, but I'll say that most of the time, everybody leaves at a reasonable hour and the workload is excellent, while you still have a great opportunity to learn from a variety of cases. You know, you won't spend 2 hours in traffic going to the clinic. You'll probably be there in about 8 minutes, which is a huge advantage. The schools in Rochester, Minnesota, if you have children, are phenomenal. We had 3 children and really had a great experience throughout all the grades, all the way through high school here in Rochester, Minnesota. It's a place where you don't need to worry about, you know, walking to the hospital at midnight if you're on call and you're called in. It's a very safe place to live, and I sincerely appreciated that. I think it's also a place where if you're interested in volunteering, it's certainly not required, but there's an opportunity for volunteering. You know, there's 3 that I'll touch on. One is Salvation Army Clinic, which is every 3rd Tuesday of the month for people who are not insured and are interested in ophthalmology care. So that is a supervised clinic. We have medical students, we have residents, we have fellows who join us there. It's a lot of fun. It's a great group to work with. And many of the patients who require surgical care or procedures are referred to Mayo Clinic. And then faculty and residents work together to provide that surgical and procedural care. So it's a great opportunity. Dr. Bernheisel, Dr. Scruggs have done a phenomenal job with the landing, which also provides ophthalmology care to patients in need, whether they have insurance or they don't. It's simply available to all comers, and it's a great clinic that is offered once a quarter. And then finally, Sightsaver is run by the medical school, and the medical school students do a great job organizing screening programs for glaucoma, diabetes, things like that. And so many of our faculty and our residents also participate in those screening programs. So I think, you know, this is a place where you can really find balance for yourself and your family. If you're a single person, we're about an hour and a quarter south from the Twin Cities. If you want something a little bit more lively, you can hop on 52 North, and in an hour, you know, you can go to the theater or, you know, whatever activities you enjoy. We have 2 international airports nearby, one in Rochester, Minnesota, and one in Minneapolis, St. Paul. I also really enjoy the outdoor activities available in this area. There's paved biking trails for miles. There's cross-country skiing, great places to run, great places for boating, fishing, that type of thing. So I really enjoy the 4 seasons here in Rochester.
We've got lots of good photos of the outdoorsy stuff. If we go to the next slide. There we go. And even more. It's so pretty. And let's go one more. Thank you so much, Dr. Khanna. I'm going to turn it over to Dr. Chen to talk about mentorship and a little bit about research.
Hello, everyone. I'm John Chen. I'm one of the neuro-ophthalmologists here at Mayo Clinic. And I think really one of our biggest strengths is mentorship, not just in surgery clinic, but also career modeling and research. You've already heard about, some of the amazing mentorship we have in clinic and surgery. But our faculty also is very dedicated in trying to do everything we can for you in terms of getting the career you want. What's nice is we have several mentors in every subspecialty. So whether you want to explore oculoplastics, retina, neuro-ophthalmology, you name it, we've got several faculty in every subspecialty. And many of our residents actually go into general ophthalmology as well. And again, I think we've got wonderful training in all the fields to do that. You're going to have some amazing role models that you can look up that can mentor you. We even have Dr. George Bartley, who's the CEO of the American Board of Ophthalmology. You've seen many of the faculty here on the call here, like Dr. Backpier, a wonderful chair, Dr. Tooley, and everyone else. And what's really nice about having the faculty here really dedicated to trying to make you the best ophthalmologist as possible is that we can also help provide connections for fellowships, future jobs, leadership opportunities, and a lot of other potential opportunities. Another huge strength of our program, I think, is our research opportunities. I think there was a question in the chat asking, is there any research requirements? And we do have a residency research thesis where you're paired up with a mentor and you present your project at the end of your PGY 3 year. And so that's what all our residents do, but it's pretty common for residents to have a lot of research projects, publish over 10 manuscripts during their residency, go to 2 meetings, even 3 meetings a year to present their work. And they're really presenting some amazing work, not just, a case report here, a case report there, but they're actually up on the podium at the American Academy of Ophthalmology and subspecialty meetings, presenting, really meaningful work that gets published in really high profile journals. And so it's again, really nice that we've got faculty in all the subspecialties and, everyone's really dedicated to trying to have our residents succeed because it's a win-win situation for everyone. It's a win for us because we have the Mayo name and the Mayo research that's being exposed to everyone. And it's a win for the resident because they get to go to wonderful places. Like I'm a neuro-ophthalmologist, and our annual meeting this year coming up in the spring is going to be in Hawaii. And so I know at least a couple of our residents are probably going to be presenting presentations there up in Hawaii. And so I think, again, a lot of wonderful opportunities. And if we go to the next slide, I can just turn over to Dr. Jessica Cracker, one of our PGY3s, and she can tell you a little more about her experience here as a resident.
Hi, everyone. I'm Jess, and that's Haley. We are hanging out. So as Dr. Chen mentioned, we have a ton of research opportunities at Mayo. Most of us go to several conferences per year. We have in my opinion, like the most generous resident-directed research funding of anyone. We have per diems for food, for transportation, our flights are covered, our hotel is covered, meeting registration is covered, and really the only requirement is that you present something. And you do get an attendance trip, which people usually save for academy because that's a little harder to get into, but there's so many opportunities across a ton of different types of research. So I'm interested in medical education. And so we've recently opened a pathway for that. And there are ways to present medical education research. Say you're not a basic science pipette type of gal like me. I'm not. So there's opportunities for that as well as several residents have gone to global ophthalmology and presented work about international opportunities. So a lot of different routes for that. We have a big number of resident publications, everything from case reports, surgical videos, to, comprehensive reviews, journal art, book chapters. I think Haley published a clinical trial once upon a time. So, and Peter, one of my co-residents in my class, actually is a basic science guru and acquired, I think, a $10,000 grant for funding for his melanoma basic science project. So we have just so many resources available to us. If you're not comfortable with statistics, if you need help on, IRB creation, we have every single resource imaginable. So it's pretty amazing.
Thanks, Jess. We can go to the next slide. Matt, I think we've touched on this, but just go over some of the trip stuff, and I'll let you take it away, this slide and the next.
Yeah, I'll be pretty brief. I mean, Jess commented on a lot of it. I think, to highlight a little bit more is, I was able to do a lot as a resident, and I had a lot of support. I had statisticians that are going to help me out. It's all for free. As far as the trips and everything go, everything's covered. There's nothing that you should be paying for. And I think, it's a really awesome time to kind of network. I think as Dr. Tooley is doing with the residents and all these photos, and they're all having fun and just kind of hanging out. We can go to the next slide. And here I think it lists, what exactly we get for trips. In the next slide. Yep. And so I think you can correct me if I'm wrong, Andrea, but the 5 trips, you can really get a lot out of it. I think it's 15 days and it's business days. And so you can kind of tag on to different things. And I really maximize that as a resident. Friday is one day, but really you can go Friday, Saturday, Sunday, and you get a day to travel, a day to present, a day to travel back. Each year, about $2,000 for each trip. It's like $1,750 plus registration. So there's really nothing you're paying for at all. And you can do that as an intern. So when you're on medicine, you can miss out on some of those medicine months and do ophthalmology trips and presentations. And even as an intern, you can get involved with the department. That's something I did, and present each year if that's something you're interested in. As Jeff said, you get an intended trip. Just one for the entire residency. We did like the Wills Eye Conference, but I think now they're doing more AAO or other things. You can do like the Bobby Osher cataract course. Some of my residents, my co-residents did that. And additionally, the Minnesota Academy of Ophthalmology, you all are become members of, and you get to go to all those meetings, which are about every few months. I was involved in the board, and that was a really good experience for me to get involved with the state board society, which is kind of helping me segue into more of like the AAO and getting involved in that from a broader standpoint. But really, I think I haven't found in talking to anybody I know from residency fellowship outside of interviewing a better program with a sort of trip and travel experience. It's just unparalleled. You can go to the next slide. Here's more photos, I think, of everyone kind of really taking advantage of all the trips. I think on the next slide. Yeah, more and more photos. You keep going.
Thanks, Matt. I'll introduce Dr. Ashley Bernheisel. We're so thrilled to have Dr. Bernheisel here as a cornea specialist and an international global ophthalmology expert, past global ophthalmology fellow. And she's going to talk to us about our international options.
Hello and welcome, everyone. So this is something that I'm working on building here at Mayo. I mean, it's really well established, this 2-week international rotation. And like it's been mentioned before, it's funded, so it's paid for. There is a possibility we're working on it to add a week or 2 of vacation to the end of it if you want a longer experience. It kind of depends on where and with whom, but that's something that we're looking at as well. And again, this is global ophthalmology. So Dr. Cheryl Khanna talked about, some of the local opportunities, which I think is kind of encompassed in all of this. And then we're also starting to create a global ophthalmology residency track. So this is something that will start during your internship and go all the way through your PGY 4-year, that will have various, reading assignments, videos to watch. I mean, it won't be a lot. It's just enough to kind of introduce you to the topics. If you want, it's going to be optional, and service opportunities. And then hopefully as part of that, again, to attend at least one of these global ophthalmology summits that we discussed earlier, to present any kind of research there. And then I think someone in the chat mentioned, opportunities for M6. And I do a M6 wet lab yearly. We can talk about potentially even doing it more if there's a lot of interest. And then I do M6 cases. So if you have one that comes up, we can scrub it together and, have you do parts of it. It is, I think M6 is a very difficult surgery. So it does, it's about learning the steps slowly over time. But it's certainly something we can introduce you to. And in terms, to go back to the trips, I mean, we're working also on formalizing a list of where everyone, what the opportunities are. I mean, we can always make something work, but we're going to, work on formalizing that just to kind of make it easy for everyone to capitalize on that opportunity. So thanks so much.
Thank you. I'll bring it back to Dr. Barkmeyer to talk about our integrated internship, which we're so excited about. And we get incredible feedback that the internship, the PGY 1 year, has really been an amazing experience. And most of that was formed and spearheaded by Dr. Barkmeyer.
Yeah, the ophthalmology department is a part of Mayo Clinic, the greater organization, the greater community. And it's really an amazing place that you kind of have to experience and see what it's all about. And we're thrilled when we had the opportunity to create this integrated internship program. You're able to have 3 months of ophthalmology within the PGY 1 year. We talked about that a little bit. We went with oculoplastic surgery, cornea, and comprehensive ophthalmology, the urgent care clinic. But then beyond that, this is an opportunity to really get you out into Mayo Clinic and all of these world-class subspecialty services and organization and groups that you get to work with, build a peer network. You get to expand your peer network. Besides, ophthalmology is a smaller program, but you get to work with people in all these other huge graduate medical education programs. But you get to learn from all of our neurologists, which is the world leading up neuro-ophthalmology program, and cardiology and emergency medicine. So you get fluent in the system that you'll be coming into to see emergent patients once you're in ophthalmology, infectious diseases. You can see this list. We had an option to make more electives, but the feedback is that everyone wants a lot of the same types of electives. So we actually locked it in so you get a lot of these different months that everyone wants. And this is a great year. You get enculturated within Mayo Clinic, and you really build that peer network that you can hit ophthalmology ground just running. We're really excited to have this. We're still tweaking it because it's 3 years old, but it's been a total success. You can go to the next slide.
I'm going to wrap this up just so that we have time for questions. Obviously, we could all talk about our program endlessly. So thank you to the faculty and the residents who are here to share our program. And thank you to you for participating and being here, asking awesome questions in the chat. We can open it up live. If anybody wants to ask a question, please do. Or if you want to put it in the chat, we can stick around and answer some more questions in the chat. Alana has her hand up and it's the first one I saw. So if you want to, I'd say go for it.
Thank you, Dr. Tooley, and thank you everyone for joining us and for this incredibly thorough presentation tonight. I wanted to know how your program values applicants who might not have a super publication heavy application, but have a lot of experience in community outreach and leadership roles, and just what your thoughts are on, I guess, resident research, I guess, thoroughness. Oh my goodness, sorry for the blurbs, I'm getting nervous. But just wanted to know, do you care about leadership versus research? Thank you.
That's a great question. I completely understand what you're saying. And I'll have, anyone else can chime in. Dr. Khan, maybe you can chime in too, because he's been on the resident selection committee for many years and is an expert on reading applications. But we read every single application from start to finish. We don't have any cutoff criteria, no score, no publication cutoffs. And we're just looking for people who are passionate about what thing. And maybe research is their thing, but maybe service is your thing. Maybe leadership or advocacy is your thing. And so do you have to have a huge research history? Absolutely not. Do we want to see that you've been engaged in ophthalmology? Yes. And do we want to see that you've been engaged academically? Of course. But does that mean that you have to be doing all this bench research? No, definitely not. Not for me. I'm looking for somebody who's interesting and passionate and is showing grit and hard work and really wants to be here at Mayo. Those are the things that I look for. Dr. Khan, do you have any other thoughts?
Yeah, and I'll actually amplify what Andrea just said. I mean, number one, it's because I get this question a lot. What's the number? How many do I need? It's quality over quantity. Number two, research fulfills a lot of different boxes. One of them is showing a commitment to ophthalmology. So we just want to know your commitment to ophthalmology. And it doesn't have to be through research. It can be through other activities, advocacy, or other things that you've done. So research is not the be all end all. It's just one of the ways that I think people show a commitment to ophthalmology. And again, it's quality over quantity.
And just like one other aspect of it, like we have no preconceptions or type or fit that we look at when we're looking at applicants. We're looking for people who have succeeded in what they do, have shown passion, and who are going to be able to take advantage of all these opportunities we have here. Like, it is such an amazing opportunity to be an ophthalmology resident. It's the best specialty. It's like welcome. But like, we have so many opportunities here. We want people to take full advantage of it.
And remember, we're biased though too.
Excellent. That's great to know. Thank you all for your input.
Thank you so much. Let me see if I don't see any. I would think that if there was a hand up, it would go to the beginning. Does anybody else have a question, or we can just kind of hang out in the chat for a few minutes? I'm not seeing any, but I want to make sure I'm not missing anything on Zoom. Otherwise, we'll hang out in the chat. It's been so wonderful just talking about our program. We really look forward to hopefully meeting some of you and learning more about you. Again, thank you so much for being here and spending time in your evening here, but really don't hesitate to ask some of the hard questions. Our residents are here. Anything you want to know. We love our program and we just want to talk about it.
So Andrea, I saw one question in the chat. Maybe Ashley can help with this. There was the question is, do you accept extra letters of recommendation? My thought is, Ashlyn, feel free to chip in on this, that if you do want to send us an extra letter, we're happy to read it. That more information is better.
But no pressure to have extra letters.
What'd you say, Andy?
No pressure to have extra letters. Like,
no, exactly. Some people do. They can't decide which letter to choose. Okay, or you did an extra away rotation, and now it's November, and you just did your away rotation. You want to include one extra letter. I think that's fine. Most people probably stick with the 3, but again, nothing is set in stone for us here. We don't have any hard cutoffs for anything.
Yep, I totally agree. So if you send in an extra letter, it'll just get tacked onto your application and we'll see it and we'll read it as we go through your app. So you're welcome to send in whatever you like. We'll tack it onto your application. We also have a supplemental question about Mayo. And so you're welcome. Oh, Paula's got a question.
Hi, everyone. My name is Paula. I am a research fellow at Bascom Palmer Eye Institute. I graduated from medical school in Colombia. And my question for you is, how do you usually navigate situations where residents come with feedback from experiences that they've had maybe in the OR and maybe difficulties that they've encountered? So how do you usually navigate mistakes or challenges during their training? Thank you.
That's a great question. And maybe Jess or Haley could chime in too if you guys have come to us with issues. I think feedback is something that's really important to us as a program. And we've always tried to make a culture that's with lots of open communication. I want to make sure I understand your question, Paula, but if the residents have an issue, it's something that we want to openly communicate and help navigate. And I always try to tell the residents, like, there's nothing they can't come to us with. That's what we're here as program leadership. Dr. Khanna, you want to chime in too?
I do. I would say that we expect people to make mistakes, right? You're students, you're here to learn. The feedback in my OR, I try to make it immediate. We just talk about every case. I tell everyone that when I do a surgery, I think about every step. What did I do great? What did I not do so great? You need to be just open and honest, and we all learn from each other. So I think it's an expected part of learning that you're not perfect. And I think everybody has a slightly different style of giving feedback, but I think in general, it's immediate. And it's expected that, you know, you're going to get better over time, and we all learn differently, and different people have different trajectories. So thank you.
Thank you so much. It's great to hear that you take into consideration the fact that everyone is at a different stage as they begin.
Thank you, Paula. Great question. There's a couple questions about protected time for research and elective time for research. We don't specifically have elective rotations during intern year for research. That's considered an ophthalmology rotation. And so we don't do that, but there's tons of time during PGY 1 year for research. There's tons of support for research. And so our residents just tend to fit it in. We also have some research days that you can use if you need to, like, either go do a basic science experiment or go through paper charts one day, or like do something where you have to be on campus. You can be excused from clinical duties. So we have those kinds of things. Tons of support for research. It's 8 o'clock. Unless I see one last minute question, I think I'll probably bid you all adieu and say thank you so much for being here.
Thank you, everyone. Have a great week.
Great. Thank you, everyone. It was wonderful. Thank you so much. Take care, everybody.
Thanks, everybody. Thanks for attending. Thanks for coming.